Good afternoon, everyone. I am State Representative Ryan Warner. I serve the 52nd Legislative District, which covers a large portion of Fayette County and a part of Westmoreland County. I want to begin by welcoming the members of the House Majority Policy Committee, and especially our expert testifiers for being with us here today. Today we're going to focus on welfare reform within the state of Pennsylvania. Recently, there was an audit released by the Auditor General, and it showed close to $1 million in public assistance benefits were paid out to 2,324 deceased members of the Commonwealth of Pennsylvania. And that's just 1 year. In addition, from the year 2013 to 2015, more than $70 million was spent in welfare benefits each year out of the state of Pennsylvania. And while it's understandable that there would be use just across our border, more than $14 million of this money was spent in the state of Florida, which is why I'm introducing legislation that will require the Department of Human Services to develop electronic controls, oversight mechanisms, and follow-up procedures to detect and track fraudulent uses. I think that this is a step in the right direction in addressing waste, fraud, and abuse within our system. I've been around a lot in our district. When I did doors and meeting constituents, I don't think that anybody has any issue with helping people in need. But it's very frustrating to the gentleman that's working 50 hours a week just to get by, and he sees someone taking advantage and abusing the system. And this is something that we have to address. Another issue I see is the system itself. And something that we're going to discuss here today is it's known as a cliff effect. You can have a single mother that's working, trying to work to get by, and is receiving child care benefits, and maybe receives a promotion to better her life. But in doing so, the state takes away all her child care benefits. And now she's actually in a worse position than what she was when she was working less and making less money. And this is something that we definitely need to address. Final issue I have with our state is the way that we gauge how we help people. You see so many statistics in the state of Pennsylvania that we brag about how many people we service on welfare or how much money we spend on welfare. I adamantly disagree with this approach. I think success should be measured by how many people we are helping to get off of the system. With that said, I don't want to take up any more time. We'll get the hearing started. But before we do, I'd like to start. I guess we'll start from my left, work our way down. If each of the members just want to give a quick introduction. Thank you.
Carl Metzger, Somerset and Bedford County.
Jesse Topper, 78th District, Bedford, Fulton, and Franklin counties.
Tommy Sankey, 73rd District, Clearfield, and Cambria.
Rick Saccone, the 39th District, Southern Allegheny and Northern Washington counties.
Justin Walsh, 58th District, Westmoreland County.
My name is Lee James.
Matthew Dowling, 51st District, Southern Fayette and Southern Somerset counties.
Sorry, Matthew. My name is Lee James. I represent Venango County and a portion of Northeast Butler.
49th District, parts of Washington and Fayette County, the Mon Valley, Bud Cook.
Aaron Coffer, 120th District, Northern Luzerne County.
Chris Dush, the 66th District, Jefferson, Indiana counties.
George Dunbar, 56th District, Westmoreland County. And some late arriving members.
And we have some members, so I'll let them take a moment to sit down and introduce themselves.
Thank you, Representative Warner. I am State Representative Kate Klunk from York County.
Representative Eric Nelson from Westmoreland County.
Representative Seth Grove, York County.
Say it again.
Representative Seth Grove, York County.
All right, well, let's get started here. We'll open with our first testifier, Sam Adelson. I hope I pronounced it correctly. Foundation for Government Accountability.
Thank you very much. Representative Warner and other members of the House Policy Committee. Great turnout. My name is Sam Adolphson. Great pronunciation, Representative. Thank you. I serve as a senior fellow at the Foundation for Government Accountability. FGA is a free market think tank focused on healthcare and welfare policy issues. I really appreciate the invitation and opportunity to speak with you today about welfare reform. And I applaud your diligence in taking the time to dig into this issue. It's not always the easiest issue. Not always easy in this day and age to move past the tweets and headlines and to do the right thing. One of my favorite quotes from James Madison is, "A people who mean to be their own governors must arm themselves with the power which knowledge gives." So I think you're to be commended for seeking out good answers on these tough issues. Before I joined the Foundation for Government Accountability a couple months ago, I had the privilege to serve as the Chief Operating Officer for the Department of Health and Human Services in Maine. And I was in that role for several years. Working for Governor Paul LePage was an honor. His leadership changed the course of our history in the state of Maine, and welfare reform was one of his chief accomplishments. I want to take a few minutes today to tell you more about what happened in Maine, what's happening with the movement for welfare reform nationally, and how Pennsylvania can move forward to decrease government dependency and promote work. Pennsylvania has a great opportunity to improve their welfare system by expanding work requirements for able-bodied adults, improving integrity of your welfare programs through regular audits of recipients, preserving welfare benefits for the truly eligible with limits on earnings and assets, requiring parents to do their part before asking taxpayers to help, and fighting welfare fraud and closing loopholes that make it easier to scam the system. Before we jump into the details in each of those areas, I want to tell you a little bit about what happened in Maine. The reform in Maine started with a simple understanding that there is no substitute for work, for a job, and for self-sufficiency. Government-issued plastic cards don't lift people out of poverty. We know that for someone in need, that first paycheck is so much better than that first EBT card. And it's not right that we allow able-bodied adults to stay stuck in the rut of government dependency. It's better for them, their families, and everyone if they're moving off of welfare and into work. And this is the approach Governor LePage and our team in Maine took as we turned Maine from being a leading welfare state into one that promoted work. When Governor LePage took office in 2011, 1 out of every 3 Mainers was on some form of welfare. It was a crisis. We were at the top in the country in food stamps, cash welfare, and TANF, Medicaid, right at the top of the list for those programs. We had individuals getting cash welfare for more than a decade. We waived work requirements for everyone, and we expanded welfare whenever possible. We did Medicaid expansion way back before it was cool. The result was a poor economy, annual state budget shortfalls of hundreds of millions of dollars, and $500 million in debt to our hospitals. And funding for things like schools and roads was regularly cut to pave the way for more welfare expansions. Even worse than that, our traditionally strong work ethic was being eroded. Governor LePage dug into the problem, and he applied solutions centered around work, individual responsibility, and fighting welfare fraud. The results have been great. Maine transitioned 80,000 people off of Medicaid. We led the nation in food stamp reduction one year, and we moved thousands off cash welfare and into jobs. Today, Maine has its lowest unemployment rate in 40 years. The state budget is balanced, and we have $1 billion in the rainy day fund. A clear set of principles guided this transformation in Maine. Welfare for able-bodied adults should be temporary. Those who can work should work. And individuals who have the means to support themselves should not rely on taxpayers. And also, welfare fraud must be stopped to protect the truly needy and the taxpayer. And when Maine required able-bodied adults on food stamps to work, train, or volunteer, we tracked those individuals for a year after they left the welfare program. They ended up earning more than double what they earned while on welfare, and the average person now earns above the federal poverty level. Work is what worked to move them out of poverty. And FGA also partnered with Kansas on the same study, and the results were the same. People were better off. In Pennsylvania, this same opportunity to promote work is available to you. Pennsylvania, like most other states, stopped requiring able-bodied adults with no kids to work while they were on food stamps. It was typical during 2008, 2009, during the recession, for states to waive this. But the economy has improved. Pennsylvania now requires able-bodied adults in a few counties to work, but received permission from the lame duck Obama administration to continue to waive work requirements for more than 40 Pennsylvania counties and cities. Most of these counties have unemployment between 5 and 7%. And many of the counties are also bordered by other counties that have unemployment under 5%. And just for context, you probably know the all-time low unemployment in Pennsylvania is 4%. And in Maine, we actually found that in more rural counties with higher unemployment, people were more likely to meet the work requirement. These kind of work requirements across the country. 17 states now have the requirement in place statewide, including Florida and Texas. And work requirements are also being discussed at the federal level. Pennsylvania has a great opportunity to promote independence by expanding its work requirement to all able-bodied adults without children. It's a proven policy that moves people from welfare to work, increases their incomes, and helps employers fill open positions. Another key reform that Maine made was to reinstate the asset test in the food stamp program. The federal program is designed with an asset test, but many states, again, including Pennsylvania, waived that requirement, allowing people with significant resources to stay on the program. For Maine, it wasn't a difficult decision to reinstate the asset test in food stamps. It's common sense. Someone who has several $1,000s in cash, or four-wheelers, or jet skis, or other recreational vehicles should not be asking taxpayers to provide for them when they have assets at their disposal. It's wrong for government to take tax dollars from a business struggling to make payroll to give an EBT card to someone with a new snowmobile in the garage. States like Michigan, Texas, Virginia, and others have recognized this is a problem, and they've reinstated their asset test. Pennsylvania is ignoring assets altogether when checking for food stamp eligibility. And that allows people who shouldn't be eligible for benefits to linger on the program. This can be corrected by requiring that the asset test be restored. Another opportunity for reform that promotes independence is requiring cooperation with child support. When kids and families get the child support they're supposed to receive, it reduces poverty dramatically. Child support is one of the best anti-poverty programs we have. When families receive the child support they're owed, it increases incomes by 54%. Unfortunately, kids often go without this financial support from their parents. And as a state, you have some tools available to you to make sure kids are being supported. One of those tools, very valuable, has gone unused by most states, including Pennsylvania. And the federal government allows states to require cooperation with child support in order to receive food stamps. But Pennsylvania has declined this option. And it makes a lot of sense to require cooperation. If a non-custodial parent is not fulfilling their obligation to their family, they shouldn't receive food stamps. If a custodial parent is asking taxpayers to support them, they should first make every effort to ensure the non-custodial parent is contributing their share. Requiring child support cooperation is an opportunity for Pennsylvania to boost incomes for poor children and families. To support these same low-income families and protect taxpayers, it's also critical that welfare programs like Medicaid, TANF, cash assistance, and food stamps are free from fraud. Michigan found 7,200 lottery winners on their welfare programs, including one person who had won more than $4 million. And in Maine, 3,700 significant lottery winners were found still collecting food stamps, Medicaid, or cash. And I know Pennsylvania has had this problem as well, according to some previous reports in your state. I think we can all agree that millionaires and lottery winners don't belong on welfare. To combat this problem, Pennsylvania can cross-check all state lottery winnings with their current welfare rolls. This is something we did in Maine and something other states are doing. It can be done very easily with a basic data match. And if people don't report winnings, they should be reported for a fraud investigation. There are dead people on welfare too, as Representative Warner mentioned. Maine found thousands of dead people still open on cases, and in many cases, the EBT cards were still being used. In Ohio, there were more than 1,800 deceased people in one review period, and in Illinois, they were paying more than $12 million at one time for dead people on Medicaid. The Pennsylvania audit that the representative mentioned showed thousands of deceased people receiving benefits on their EBT cards. But did the audit also check Medicaid for deceased recipients? It should. To make sure that welfare is going to the living, Pennsylvania can simply cross-reference the death records the state already has with the welfare rolls, and this should be done monthly. Unfortunately, we're seeing these kind of scams across the country. In Oregon, they just found that 32,000 people may be on Medicaid inappropriately at a cost of $167 million a year. And a Minnesota audit found that 38% of the people sampled should not have been eligible for the Medicaid program. This has happened because they aren't checking people's information regularly enough, and they aren't checking and verifying enough data. The problem is especially acute in states like Pennsylvania that have expanded Medicaid and seen rapid growth in the program. To make sure this isn't happening right now in Pennsylvania, a welfare audit should be conducted to stop the scam. The state can use third-party data to check things like income, assets, and residency to make sure that only those who are truly eligible remain on the program. This could save the state millions of dollars. And more regular checks should be done as well. Many states, including Pennsylvania, have used federal loopholes to let people report changes to their income and situation less frequently. In food stamps, for example, a state option called simplified reporting lets people go for months and years without reporting changes in their income. This is an easy loophole to close. You just require that people have to report changes within 10 days of when they occur. There's no doubt the best way to prevent welfare fraud is to move people off of welfare and get them back to work. But for those who remain on the program, there are still major fraud challenges. Unfortunately, there is a dark side to EBT cards or access cards in Pennsylvania. Once upon a time, when a drug raid occurred, law enforcement might find drugs, guns, and cash. Now, drug agents find drugs, guns, and EBT cards. Trading EBT cards for drugs is so prevalent that one Maine drug enforcement agent testified in front of our legislature that it was, quote, common practice for drug dealers to take custody of a drug user's EBT card, either as direct payment or in lieu of immediate payment. And in Maine, like you've seen, we saw EBT cards being used outside of our state on a large scale. In 2011, when we first checked, there was more than $15 million each year being spent in places like Brooklyn, the Bronx, Worcester, Massachusetts, and even your own Philadelphia. And these are known to drug agents in our state as places that are sources of illegal drugs coming into Maine, coming up what we call Heroin Alley, I-95. It's a big problem. In Ohio, the state auditor reported $28.7 million was spent outside of Ohio in 1 year. And in Massachusetts, their cash welfare was being spent in Florida, Orlando mostly, not sure why, and Las Vegas, Nevada. When we dug into this information in Maine, we found many people that were not living in Maine anymore, and we're able to remove them from the welfare program. And we cut in half over 3 years the amount of our welfare that was being spent outside of Maine. Also in Maine, more than 75% of people who closed off of food stamps also then closed off of Medicaid and stayed closed. And this saved the state about $49 million a year. In Maine, our regular review of the EBT data also led to an FBI investigation and indictment of a store owner who was exchanging cards for cash and filing fake tax returns totaling more than $3 million in just 2 years. To combat this fraud, Pennsylvania should take a hard look at their EBT transactions. Regular review of the data, where and when the cards are being used, will help to fight fraud and protect taxpayers' resources. An annual public reporting of this data is very helpful as well. And finally, it's worth noting that Pennsylvania still allows people receiving cash welfare, TANF, to get benefits for 5 years, or more in some cases. 20 states now have shorter time limits in the program, and more states are looking to move people off welfare and into work more quickly. For example, Arizona's time limit is 12 months, Connecticut is 21 months, and Kansas has a 24-month limit. And these time limits are proven to get people off the program and back to work. So a study that was just released in Maine, you probably haven't seen it yet, we'll make sure you get it. They tracked 1,800 people who hit the 5-year time limit in 2011. Maine was not enforcing the time limit. Governor LePage started enforcing it, and a bunch of people came off the program. Maine tracked them. 5 years later, the total income of that group has increased by 237%. Welfare reform works. Getting people back to work is what works to move people off welfare, out of poverty, and onto a better life. And states don't have to and can't afford to wait for the federal government or someone else to solve this crisis. The tools are available right now to help people move towards independence while protecting the truly needy and taxpayers. Thank you for your time. I would be more than happy to answer any questions.
Thank you very much for your testimony. We will open it up to questions from members. We will start off with Representative Saccone.
Thank you, and thank you for your testimony. The work requirement, I'm wondering what kind of system you had in place in Maine, because when we had work requirements here, I was in the private sector, and they had people had to show that they were actively looking for work, and people would come into my business and have an interview, and so that they could sign off that they were being interviewed. They had no real intention of getting a job there. They just wanted to show that they were looking for work so they could keep getting their benefits. So if you could talk a little bit about what system you had to stop that. And also my other question would be, on the lottery winnings, people automatically get angry when they hear that. And the millionaire examples are great, but what is the cutoff? Because people are going to say, hey, I won $500 in the lottery, you're going to take me off my benefits. What was the cutoff that you used in Maine? What do you recommend if someone wins $1,000, if someone wins $200, someone wins $10,000? What was it? If you could answer that,
Sure,
appreciate it.
good question. The work requirement, that's an interesting point. So there's a handful of different kind of work requirements through the welfare programs. What you're describing sounds like unemployment benefits, a lot like that, right? You have to apply for 3 jobs to continue receiving your unemployment benefits. TANF, Temporary Assistance for Needy Families, which is kind of traditional cash welfare and job supports, they have a little different work requirement that includes things like job search and work experience. The work requirement that I'm really talking about in the food stamp program, and this was designed in the 1996 Bill Clinton welfare reform, is a pretty strict work requirement. So you have to actually go to a paid job 20 hours a week, or you can volunteer for what amounts to about an hour a day, 24 hours a month, or you can be in a official training for employment. That's the work requirement we implemented in Maine, and I think that's the effective one, because like what you're saying, there's a lot of other activities that you can kind of do. We're talking about urgently returning people to a job. Get up, go to work, and get paid. And that's the work requirement we want to see expanded. The lottery winning. So in Maine, what we did was we aligned the amount that we called significant with our asset test. So our asset limit for you to continue getting food stamps was $5,000. So you could have, a couple thousand in the bank and still be eligible for the program. But once you got over that $5,000 limit, you weren't eligible. So we aligned the lottery winnings to go along with that. The federal government, this was like last minute under Obama. They said that significant lottery winnings was 25,000. We disagreed with them. That's too much. So I've seen other states, Michigan's had it set for a while at $1,000. But I think probably if you think about aligning it with the asset limit, that's a good way to approach it. The federal asset limit amount. So say if Pennsylvania decided we're going to just go with the federal rules on the food stamp program, their asset limit, the one that has been waived, is $2,250.
Representative Dunbar.
Thank you, Representative Warner. I'm going to follow up a little bit on what Representative Secundus had asked about work requirement, because I do understand where you're going with this, and it truly is the one way we can help these individuals not only get off of welfare but escape the cycle of poverty that they're in, is by having a good paying job. And I understand that several members here, Representative Grove, I believe, has a bill with regards to work requirements, as does Representative Coffer. But ultimately, when you have the work requirement, there has to be a job. There has to be some type of job that they can enter into to get off the welfare rolls and escape the cycle of poverty. And I was just curious as to what has Maine done, what have they done to provide that as jobs? Or, because the fear is this, if we put a work requirement out there and we have individuals that say that you have to go to work, and then we sometimes, the way we are here, we end up creating a job for them, and you just replace one type of welfare with another type of welfare. So I'm just curious as to what Maine's done to actually produce the jobs as well.
Yeah, it's a concern we've heard. So when we first put this requirement in, we we went on a field trip. We went up to northern Maine. We call it down east, but it's really up, so it's kind of weird. But down east Maine, it's like up the coast, almost to Canada, very rural, like parts of Pennsylvania. Because we thought that would be a good place to see, like, will this work? Are there places for people to go, jobs for them to do? And we met with this family business. They make Christmas wreaths. They get shipped all over the country. We have great forest products in Maine. So we met with this guy. The family business is in the third generation. And 5 minutes into the conversation, he was crying. He can't find people to work. And he knows, he's got people all in his community that he knows, he's seen grow up, play on the sports teams, whatever, and they're just not working. And he talked to our commissioner about the fact that these cases all get linked back to our department, where they're getting something from us that's kind of keeping them from jump starting and going forward. So that experience continued to happen as we went around the state. I think the jobs are there. There's 6 million jobs open right now in the country. I think I've heard many more times from an employer saying I can't find someone to work than I have from a person saying I can't find a job. And when you look at the I can't find a job piece of the equation, there are usually barriers, and oftentimes it's barriers we've created with some of these programs. So that's kind of been our experience in Maine.
Yeah, and I get that, and we hear the same things, that the excuse of, well, there's no jobs. And certainly we don't want to force people off of welfare rolls if there are no jobs. And we also always hear the problems is, well, they can't find anybody to pass a drug test. We can't find all those other type of things. But I do appreciate in the grand scope that work requirement is, in Westmoreland County, we actually have that. We're one of the few counties that do have a work requirement for welfare.
We also have, just to add, we saw a huge increase in volunteerism, because that is in the specific food stamp work requirement. That's a way that you can meet the requirement, which I think is really sound principle. Like, okay, if you can't find a job, let's do something, like to be productive, help your community. And we actually saw, there's a Wall Street Journal article about it. We saw this huge influx of people who were going into their local, whether it's food pantries, community action programs, and saying, hey, can I help out? I need to meet this requirement. And then they were getting that experience, right, as a volunteer. So there are other ways, if there really is a place where there's just no job available to them, there are other ways to meet the requirement.
Thank you.
Thank you, Representative Dunbar. Representative Coffer?
I have a couple of questions. First of all, thank you for your testimony. Thank you, Ryan, for hosting this hearing. With your acid tests, did they start immediately? Is that how it worked? That if, say, for instance, somebody lost their job and they go on unemployment, also they try to go on to food stamps or something, the acid tests in these states that you're talking about, they started immediately?
Yeah, if I understand your question right, somebody has $20,000 in cash and they lose their job, does the asset test start right then?
Mm-hmm.
Yeah,
Okay.
It would. So the principle is, if you've got a 2014 Yamaha sitting, side by side, sitting in the parking lot, and you fall on tough times, you need to take care of yourself first, and then once your ability to take care of yourself is kind of being compromised, then you come ask us for help. And I think what we found was a staggering amount of that. People who had, and this is something you hear, I'm sure you've heard this on the campaign trail, that's where the guy working 50 hours a week gets frustrated. Like, he has 2 snowmobiles and, and I can't afford one because I'm sticking to my budget. That's frustrating. So I think that's where we want to ask people to do what they can first.
And one more question from me. Do you have any statistics on transitory families or anything like that that you might have seen when these were implemented of people? Because that seems to be a big issue in my area. We have people that are coming from different states moving into our school districts. I just had a conversation with it just within the last couple of days with our superintendent dealing with it. Any comments, or have you seen anything like that, or any evidence that that might be reduced as well?
Based on the change,
Some of
in
the changes that
benefits.
right.
You know, not good hard data in Maine, mostly anecdotal. But I do know that as we went through a lot of these cases, we did see a great number, particularly the able-bodied adults with no kids, right? That population is pretty transient. And we certainly noticed a lot of those folks that left the caseload, we couldn't find them. When we went looking for how are their incomes doing, and we searched like wages and earnings and other state databases, they had kind of disappeared. So I think there's pretty strong anecdotal evidence that what you're hinting at is true, that some of these people do kind of migrate to where maybe there's a program that they want to get on.
Well, I just want to say thank you for coming and testifying about this stuff. I just learned yesterday for some of the data in my county, 1 in 5 people in Luzerne County are on food stamps. 1 in 5. And to me, that's a staggering number. And you know, when you're talking about the work ethic being eroded and things like that, you know, in my opinion, this is the biggest area that we as the legislature need to be addressing. Not only are we talking about reducing government spending, but also increasing revenue by getting people back to work. And I just want to say that I really appreciate it, and thank you, Representative Warner, for putting this together.
And thank you very much, Representative Coffer, to announce the presence of Chairman Benninghoff. We will go on with our next Representative Dush.
Thank you, and thank you, Ryan, for hosting this, and Sam, I want to thank you for your testimony. First of all, you had said your numbers for Maine, 5 years later, the people you tracked down, it was 200 and what % increase in their income after they'd...
Sure, so 237%, which, to put in some non-mathematical terms, that group went from, as a group, they earned a couple million while they were at the end of being on the program. They now earn $8.5 million.
That's phenomenal. And that is exactly what these programs were actually set up to do, which is help them transition and get out and into the workforce and become self-sufficient. You know, my dad was a placement counselor for Voc Rehab, and he had this thing that we can be responsive yet responsible. Responsive to the needs, but responsible in our approach in order to make sure that we get these people the leg up and the sense of, like Ronald Reagan says, the best welfare program's a job. And Dad's goal was always to be able to at least come back 5 years later, and his guys that he had gotten into the workforce are still there in the workforce. And he had some remarkable successes, and it was great going door to door and having people say, "Are you Ray Dush's son?" And when I said, "Yeah," and they go out and start talking about how they had no hope, but now they're in the workforce, they're supporting their families. This is the way I think everybody on this panel and most of us in the legislature want to see a responsible way that is responsible to the needs, but responsive to the needs, but responsible to the people who are paying the bill as well. I appreciate your information, especially this that I just asked, and some of the information you also provided about the asset cutoffs and the way to help transition those folks in. Thanks again.
Thank you.
Thank you very much, Representative Dush. Next, we have Representative Sankey, and you say someone.
Thank you very much. I usually don't ask a whole lot of questions, but this one's pertinent, and I appreciate you coming. And the reason I ask is you seem to be an expert on this, and it's 40% of our state budget, so it's clear Department of Human Services is clearly an issue when we're having budget shortfalls. The question I ask is, and I'll finally get to it, but a cultural shift. When I was a kid, my mom had a convenience store, and people had the paper tear-off food stamps. The vast majority of people who came through there were out of a job or having problems, and they were embarrassed for what they were using food stamps to buy their food. Now, everyone in this room, I'm sure, has seen plenty of able-bodied people, young people at the convenience store swiping an access card. And the reason I'm asking is because when you inherently give someone something and take it away, whether it's your child or it's the state giving out other people's coffers, there's a certain level of resentment no matter what when you take it away. So my fear is that our culture is slowly changing towards government dependency, which is a failure 100% of the time. The question is, in your research, how difficult is a cultural shift to get people wanting to be back to prosperity, swing the pendulum the other way, and make it effective without the outcry from the public that we're cutting assistance?
That's a great question. We have in this country more people on food stamps than the entire population of Canada. I mean, it's not good. And we got there it wasn't just the recession, and it wasn't just increased need. It was on purpose, very specifically driven, mostly from Washington, D.C., but states are absolutely complicit in it. Through a lot of these policy decisions we're talking about today. And I think the biggest cultural shift is exactly what you said. The program used to be for the truly needy. It's the way they were designed, and I think we're proud of that as a country. We help the truly needy. You know, we help our families and our neighbors that are in need. But they took all that goodwill and went way beyond. And that's why we really focus in on that able-bodied population. I mean, there are a lot of other programs we're not talking about today for disabled people and people struggling with other things, the elderly, poor children. So that population in particular, I agree with you. On the tear-off food stamps. So in the history of the food stamp program, it used to be that you actually went in and bought your food stamp, and you would get more value by purchasing that food stamp. So it took $1 you earned and kind of subsidized it a little bit, helped you stretch that budget, but you had to put the $1 down to get the food stamp. Bob Dole actually was the one that changed that. I'm not sure why, but so the way I think about a work requirement is it's bringing that back. It's making you invest in the benefit a little bit, so you don't have the same approach or mindset to it. Like, we'll help you, but you've got to put your $1 down that you've earned to make sure we know you as a able-bodied person are trying your best to get ahead. So I don't know how, I don't know exactly how quick you can shift your whole culture that way, but I do know what I saw in Maine, which was a little bit of political noise about it, and then the change happened, and then great results happened very quickly, and also for all the controversy that you're going to hear about these issues, 80% of people want these reforms. That's a fact. I mean, this is not a partisan thing. People understand the best way to live the American dream. Being on welfare is not the American dream. It's not going to get you there. So we need to make sure that the design has that culture in mind.
Thank you very much, Representative Sankey. Representative Nelson?
Thank you, Representative Warner. And the timing of this question, the order really worked out great, building off of Representative Sankey's perspective of this battle that we have between assistance, which is vital, and dependence, individuals and families that are losing the ability even to have an opportunity to rely on themselves. It's almost institutionalized dependence. Some of what we've seen in our district for employers that oftentimes they're even held hostage by the underground economy where there are jobs that are out there, but I hear from employers where people come and apply for the job and say, but anything more than this must be under the table or else I'm going to lose my other benefits. My question is geared towards the relationship of, the food stamps, or for us it's SNAP or the Access Card. Our church just recently held a fundraising drive for diapers for individuals that are involved in this program, because in Pennsylvania, you can't buy diapers with the Access Card, but you can buy puppy pee pads and a number of other things. What were some of the reforms that you saw in how those dollars were able to be spent, if you could?
Yeah, good question. There's been a few different attempts by states to limit what you can use food stamps for because of the amount of junk food and things that have been bought. That's been studied. I think it was something like 20% of the benefit is spent on soda. So far, the federal government isn't interested in changing what the benefit can actually buy. So I think it's important. Personally, I've been in plenty of convenience stores where somebody bought a lot of Mountain Dew with their EBT card and then pulled out cash and bought other things, cigarettes or whatever, and it's frustrating, really frustrating. But it's the way the program's designed. It doesn't seem like the federal government's going to change it. And frankly, I'd rather just get them off welfare and get them their own paycheck, and then they can buy whatever they want, and it's kind of their problem what they decide to purchase, their decision. But I do think the program should look more like WIC. WIC is a better program. We oversaw that at the department as well, and it makes a lot more sense in the way it's set up. A mother comes in, they talk about what kind of food they need. They actually call it a prescription, and there's certain things that they can buy. I like that design. Just on the institutionalization of it, you're so right about that. And I think like the simplified reporting it's a policy wonk kind of thing. It's hard to think about, but that's exactly what it does. So the federal government, this was all in the name of administrative efficiency, which everybody loves, right? I mean, we all love that. Be as efficient as you possibly can in government. The problem is they use administrative efficiency as an excuse not to check anything. And then the error rates go down because you're not checking anything. So what those kind of policies do is they institutionalize it. Everybody here has probably signed up for something at one point and put it on auto pay, and you forget about it, right? Maybe it's a $3 a month app or something. And that's what they've done with food stamps. Once you're in the door, in Pennsylvania, it's 12 months. You don't have to check back in unless you have a change that reaches a certain threshold, a high threshold. You don't have to report changes. So I can get a different job, or my income goes up or down, or my household fluctuates, who's living in it, and the feds say, nope, you're fine, just stay on the benefit, and every 12 months you can check in. So that's an example of how they've institutionalized the programs.
Okay, thank you very much. Thanks.
Thank you very much, Representative Nelson. Representative Saccone for a second time.
Thank you. We've seen an alarming decline in volunteerism in Pennsylvania. When our volunteer fire departments have gone from 400,000 down to 58,000, for example. Requiring the volunteer effort and I would like to see that piggyback. Like, say you have to have 18 hours of work and 20 hours of volunteer. It has to total 40 hours a week to get benefits, something like that. But did you see in Maine, when you instituted these restrictions, that your volunteerism increased, especially because it's not just fire departments. We see that our volunteer groups across the board are declining. And it's mostly, it's seniored out. We have our Rotaries and our Lions Clubs, and lots of elderly people working them, but the young people weren't signing up. So did you see an increase in Maine for volunteerism when you did this? Do you have any stats on that?
We did. I don't have stats. It was hard we tried to track it, but there's so many community groups that it was difficult to do. There certainly was an increase. I think it goes back to the cultural problem. When someone runs into a problem now, they turn to the government. You lose a lot of that community feel, right? A lot of that community support, someone who gets help from the community and then gives back later because of that experience. We're definitely seeing that in Maine as well, especially the fire departments. That must be a thing across the country. That's a work ethic problem, in my opinion. Too many people not interested in hard work and helping their community. One thing I would say on a policy note with the volunteer piece, because you're going to hear this when you get, if there's a bill in session or whatever, the reporting requirement on volunteering is poorly designed by the federal government. So one of the things we heard was, it's hard to find a job that, a volunteer position that counts for the federal government. We didn't really have a problem with that. The volunteer roles that people were taking on worked very well in Maine. But just if you hear that, keep in mind that the federal government is going to be a little easier for you to work with now than they were. We've talked with them about this problem, this perceived problem. So I think the volunteering piece is really important. Yeah.
Thank you, Representative Saccone. Representative Cook.
Thank you, Representative. A comment and then just a quick question, sort of an observation. And I'm sure all my fellow representatives hear this. I pulled up and to the guard today on the way in here and introduced myself. And his question was, why are you here today? And I said, welfare. That was good for 15 minutes right there on that part. So I think there's a real desire out there. I know I hear it all the time, and it's the unintended consequences that we suffer trying to do good. So the question is, you had mentioned the card showing up in reference to drugs. Do you have any sense, if nothing else, a gut feeling, how much the welfare abuse is contributing to the opioid problem, your experiences? Thank you.
Yeah, I have a memo. I'm not sure it's in your packet, but I'll make sure you get it if it isn't on this very thing. Indiana was looking at that. There were people making an argument that more welfare would help the opioid problem. I will tell you, particularly for this able-bodied population who should be working, the ones with no kids, it is a major problem. I mean, we looked these folks up. Every time there was a drug arrest in the state of Maine, we cross-referenced it. I don't have a statistic for you, but I can tell you it was all the time. They had EBT cards. And when you stop and think about the profile of the person, this is an able-bodied, non-disabled adult, between 18 and 49 years old with no dependents. So that group is a population that should be at work, really has no barriers to earning well above the poverty limit. So what we found a lot of times was they weren't, they were they were out doing other things, I guess is a nice way to say it. There's another element to this that's really prevalent, which is like more organized crime. I mean, we had drug raids where the dealer would have 6 or 7 cards on him, and people would have traded them to him in exchange for drugs. I can't give you a number, but it's out there. If you ask, so what I would say is an action step to kind of validate or trust but verify, I think is another Reagan slogan. Go talk to your law enforcement. And that's what we finally just said, why has the welfare department never talked to the law enforcement department? You know, because we have a lot of interconnection. And so we sat down with a round table of all the sheriffs in the state. We showed them the out-of-state transactions in Brooklyn. We talked to them about their arrests, and we worked with the jails. Every time they got an EBT card in jail, they'd turn it into our fraud team. So I think that would be a good thing as a state to do, is make sure those two entities are talking to see where there's crossover and what can be done about it.
Thank you very much.
Thank you, Representative Cook. Representative Grove?
Thank you so much. At one time, we had an asset test in Pennsylvania passed with a welfare package we did, I think 2011 to 2012 timeframe. The decision was to then scrap it because it cost too much money, our error rates increased, and it was a lot of staff time to go through and do the work. And there's a lot of argument with, welfare requirements. It's going to require staff time. You're going to increase costs, right? That's the argument for not doing these things. In your assessment in Maine, the asset test, what was the cost and what were the benefits to that moving forward, particularly with the assets test, because we did have that and it was determined actually under, I think, Governor Corbett, Republican at the time, to do away with that.
Yeah, I tell people sometimes welfare reform is magic. It can turn even a liberal into a fiscal conservative. The second you try to spend money doing something good, they don't want to spend any money. What we found in Maine was that the cost of implementing the reforms is canceled out by the number of people coming off the programs. So when they were looking at that cost, what they probably weren't doing is following a person over to other programs. So yeah, it might require a little system change in my computer system that costs $100,000, and I might say, well, that's money I didn't spend before, and because food stamps is funded entirely by the federal government, well, we didn't save any money. It cost us money. But that's not looking at when the person came off food stamps, did they leave Medicaid as well, which is funded half by the state? Did they get a job and they're now paying taxes into the state? There's a one-track view of it. And then the other more simple thing that we've seen across states is caseloads decline. There's less work. So you have to let it play out a little bit to start to see some of the results. And then some of it I can tell you from my position in state government, some of it's just made up in excuses. All due respect to you have hardworking civil servants. Sometimes they just don't want to implement these things. Sometimes it's hard. I mean, I had many experiences where I was tasked with implementing something that was difficult. And it's easy to say, well, this costs a little too much, so we can't do it. So I think if you're getting that information, make sure it's accurate. Make sure they're not overlooking something. And take a broader view of it. What's happening to this person that benefits the state in these other ways as well?
And as far as assets go, we register vehicles, we register ATVs, we register snowmobiles, we register cars. We have an entire criminal database system, JNet. Were all of your kind of IT linked together in Maine so you could basically run a cross-check on throughout all those systems?
No, but a lot of states have that.
Okay.
I don't know exactly what your situation is. Technology.
We don't link anything together.
Yeah. So
there's no communication
Okay.
amongst anything.
Well, that's helpful. No, we did a lot of manual work. We did a lot of. I guess people throw around manual and automatic, but Exchange spreadsheets. It's pretty simple to run a query from one system and a query from another, and then have one of your smart, state government employees match them up. Here's the list where they cross over. It can be done, but I do recognize there's often IT challenges. The stop the scam piece that I talked about is pretty simple. You have these third-party systems where you have bank account information and things like that, and we were a little skeptical at first, I would say, when we saw some of the initial results. People living in Oregon, it was a long way from Maine, and they were telling us, no, look, this is what we have, this is where we think they live. And we're like, well, but the address says they live here. And sure enough, their information was more accurate than ours. So I think it's worth looking into those other data systems. Yeah.
Thank you, Representative Grove. Next, we have Representative Klunk.
Thank you, Representative Warner, and thank you, Sam, for joining us today. So my question is in a similar vein as Representative Grove's. So we're talking about IT data systems within the state talking. And I know in one of your handouts it talks about stopping individuals from collecting welfare in multiple states. So what did Maine do to stop that? Were they part of a regional compact? What type of IT systems did they implement? And how could we achieve that here in Pennsylvania? I know we have, Representative Coffer has a residency verification compact bill. Have you taken a look at that? Do you have any recommendations for us as we consider that bill from your perspective in Maine?
I haven't seen the bill yet. There's two things I would do. One is just look at EBT data. That was our biggest way we found people out of state, because pretty simple logic. You just apply the logic to the data. If somebody spends $200 a month in another state, especially one that isn't neighboring, we only have one neighbor, New Hampshire, but if they spend $200 a month in Texas for 3 straight months, it's a no-brainer. And we'd follow up on that case and close it down. So that's kind of a simple way. Your department today can run a report on EBT card transactions. They can tell you the name of the store, the time the card gets swiped, and how much it was for. So just making sure that's happening would be the first thing. And then there's a formal, I don't want to sound like a salesman, so I'm going to do my best not to, but there's a program called the National Accuracy Clearinghouse that was first piloted with 5 states down south. I think it was Missouri, Florida, Georgia, and a handful of those states, where they pulled all the data in from all the states and cross-referenced it. I believe that's being expanded. That's how we ran our stuff in Maine. So that would be worth looking into. But they do exist. That type of program exists.
And so how many people were you finding in Maine who actually didn't live in Maine, hadn't contributed in Maine, and were actually from another state?
Thousands.
Thank you.
Mm-hmm.
Thank you, Representative Klunk. Up next, Representative Coffer.
Thank you. Since we were talking about my legislation, I'll jump in for a second. The idea, at least, is not only cross-checking with other states, but also to make a cumulative period of what people could collect, as the TANF system being a 5-year pass-through. That there could be other states that say, within our states, if you're part of this compact, you can get 5 years total amongst the multiple states, which is also part of this as well. So we don't have people bouncing from state to state to state, maxing out benefits, which I also think is an issue going on across our country as well, which sounds like that clearinghouse is working on. But I have one other question that sparked after I had already asked a couple questions, but have you seen anything with cash-based service jobs like a waiter or a waitress, anything that might have been, that people were working and making good money, but also claiming that they weren't making that money? Was that something that you saw in Maine at all as well?
Yeah, that's kind of traditional welfare fraud. I guess traditional might not be the right word, but we took a really strong approach to that. The governor, when he first came in, one of the first things he did was double the number of fraud investigators. And this is one of those areas, again, where you're spending some money up front to install those folks. We went from 4 cases, 2010, our department referred 4 cases of welfare fraud to the Attorney General. Last year, we referred 176. And there were those kind of cases. Someone who says they live alone, but their spouse actually lives with them and their income went unreported. A person earning cash. We get a lot of lobstermen, elver, baby eel fishermen, blueberry rakers, carpenters getting paid getting paid cash. That's more of a task for a welfare fraud investigator. And some of the data stuff we've been talking about can show that. But if it's more of a black market or gray market issue, you do need some boots on the ground to take care of that stuff. And I will tell you, that gets around quick. Out there, we intercepted jail recordings of people saying, we had one guy who asked his mom to sign his welfare stuff that was going to come in the mail and send it back in. And she says, "I can't do that anymore. Governor LePage is all over that now." So we had, word hits the street quickly when you start to pay attention to these things. I don't know exactly what your fraud investigative units look like here, but they do that good work, I'm sure.
Well, we do have an Inspector General for Welfare Fraud and a hotline, but I can tell you after speaking with these people, they're very frustrated as well, that their work isn't followed up on and their recommendations aren't followed up on. And you did mention about people in prison. We actually have that problem here in Pennsylvania as well. We have statistics on that as well, that we have people who are in prison and still collecting benefits. So I can't say it enough. I appreciate the fact that you're here and making the trip here and to testify in front of us, because you certainly touched on a lot of points that I've been saying here since I joined the legislature 2.5 years ago. So thank you very much. Much appreciated.
Thank you.
Thank you very much, Representative Coffer. I don't think we have to deal with lobster fishermen in Pennsylvania. We do have some people trying to throw catfish out on ice, though, in Pittsburgh. But,
I think you're getting the better end of that so far.
Yeah. Chairman Benninghoff.
Thank you, Chairman Warner. You've done a good job. Appreciate it very much. First of all, Sam, thank you very much for your testimony. You've done a good job, and we were very excited to have you come forward. A lot of great questions by the committee, and you say we have pretty good diverse representation from the Commonwealth. I have several questions, but I'm only going to limit it to 2. One, what type of punishment does your state have if they find someone who is fraudulent? We had a hearing a week ago, and we have merchants telling us about people who open up their wallet and they see 5, 6, 7 access cards in there, buying hundreds and hundreds of dollars of lobster, taking it down the road and reselling it, or getting cash for people to use their own EBT card. It seems like if you're not going to create some deterrent, what's the problem with committing these crimes?
Yeah, it's a great point. And the increase in referrals to our Attorney General's office for welfare fraud wouldn't mean much if they weren't prosecuting. And we had that problem. So I don't know if you're set up in Pennsylvania where district attorneys can prosecute, or if an Attorney General's office has to prosecute. But we are finding across the country A lot of prosecutors are ignoring this problem, and that's got to stop. So there's a couple things that can happen. If it rises to a high enough level, it should be prosecuted criminally as theft.
Correct.
And I don't know if you have statutes on the books. In Maine, we have one specific misuse of public benefits statute where they can charge under that specific thing if you trade an EBT card. But we also, after a lot of public pressure, got the Attorney General to actually prosecute welfare fraud cases that were greater than $5,000 in theft value, and they prosecute them as theft. So people go to jail when they buy, for example, in Maine, we had one couple buy all the food for their Chinese restaurant on an EBT card for a long time. They went to jail. So it's got to be. There are also administrative sanctions, and that's something you want to make sure your department is doing, because it's easy for those things to be waived. And the penalties are different in each program, usually like 6 months or a year off the program for the first offense, and then it gets increasingly severe. But I would really focus in on who is prosecuting welfare fraud, and is it happening, and is there anything you can do to bring transparency to that and move it forward, because that has been a huge deterrent in Maine.
Thank you very much. I think that is helpful. We do have the Inspector General's office. I know there's some administrative, but I think the Inspector General's office feels like they have no teeth, and I think the criminal prosecution is going to wake some people up quick. To keep on time, my last question is, does your state do any, and I apologize if I missed this in your testimony, have any third-party individuals doing reviews or fraud investigation? It seems to me you got vested interest. If your employment's based on keeping people on the rolls, you go and clean off the rolls, you don't have a job. So what's the motivation, and do you ever use third party?
We did use some third-party data to verify eligibility information. I think we also did a lot of internal work, quality work, to make sure that eligibility staff were doing their job. Unfortunately, we inherited, just in Maine, I can't speak for other states, but kind of a culture of dependency, even within our state government employees. There was a saying when we got there among staff that went, when in doubt, give it out.
Yeah.
And that's a problem. They, like you're saying, they don't have a lot of incentive necessarily to get it right. The penalties are more severe for not granting when someone was eligible than granting when someone isn't. So I think the other reality is, in a lot of cases in Maine, we had state employees doing eligibility for welfare who were on welfare. Think about that. I mean, the reason that happens is because we expanded welfare so far to so many people that even people holding down a good job, I mean, these jobs paid $17, $18 an hour with full state benefits and a pension. But we had expanded welfare so far that we'd swept some of them into it as well. And that created a very strange incentive problem.
Any other questions? Again, we thank you for your candor. That's not an easy task, but I think it's important for us to be able to take your information that you shared with us. I mean, we have to keep in mind, I think too many people forget who's paying the bill. It's the taxpayers and a lot of the business people who are watching people abuse the system with their own tax dollars. So we thank you for your testimony, and we'll be back in touch.
Thank you very much. Appreciate it.
Our second panel is community support for those in need. We'll start with Jim Stark, the CEO of Fayette County Community Action, followed with Jim Rowan, Executive Director of Community Ministries, Matthew Crutchman, who's the Executive Director of East End United Community Center, and Becky Ambrosini, just want to make sure I got that wrong, with a community group called Circles. as you folks get settled, I wanted to personally thank Penn State Fayette for hosting us here today, and our good friend Representative Warner, who was very excited about doing this for us, and he's done a bang-up job getting it organized. And last but not least, our audiovisual crew. For those that are listening, this is available on PCN and can pick up links for your local representatives' offices. To the panel, I don't know what order you want to go in. Since I butchered up Becky's name, we ought to start with the young lady first if she wants to, or you can go left to right, doesn't matter to me.
Well, we've been working closely together, so we're going to start with Jim.
Very good.
I get to kick it off with a little bit of the challenges that we're facing that'll lead into some of the ideas that my colleagues will share with you.
For the members' sake, we're going to let the panel all testify, and then we will open for questions. So, gentlemen, young lady, if you're comfortable, feel free to begin. Thank you.
Good afternoon. I'd like to thank the committee for the opportunity to provide this testimony and to share with you some of the challenges that we face here in Fayette County and some of the ideas that we have for addressing these issues. And forgive me, I have a summer cold or an allergy, so I'm sort of fighting that. My name is Jim Stark, and I am CEO of Fayette County Community Action, a local nonprofit agency that is commemorating 50 years of service to the local community. Fayette Community Action provides a range of programs, including senior citizen services, food bank, housing and homeless assistance, nurse-family partnership, the Work Ready program in partnership with the Pennsylvania Department of Human Services, WIC, as well as community and housing development projects. We have a long history of working with various state and federal agencies, as well as volunteers, other nonprofit agencies, private foundations, donors, to address critical problems in our community. Many families in our communities are struggling. Fayette County is a challenged county. Poverty and unemployment are high. According to the Pennsylvania Department of Labor and Industry, our per capita income of $38,609 is 23% below the Pennsylvania average. Our unemployment rate of 7% in March was the second highest level in the Commonwealth. 37% of our population works in businesses where the average annual wage is under $30,000 compared to 19% statewide. Even many of our families who are working full-time are struggling, so programs like SNAP, Medicaid, child support are essential services for many households. 35% of our working-age population, unfortunately, is not in the labor force. So improving and diversifying our economy and wages earned in southwestern Pennsylvania is certainly part of the solution. Companies need a skilled and available workforce to justify expansion and employment growth. Companies have reported difficulty in recruiting qualified employees. Training and retraining programs are important as well. So it is no surprise that Fayette County has one of the highest poverty rates in the state, 19.3%. Smaller towns like Uniontown, with a 28% federal poverty rate, are among the poorest in the Commonwealth and don't have the resources to fully address the problems. So we have a lot of work to do. Poverty is worse for our children. 39% of our children live in single-parent households. 57% of our children are living in families with income below 200% of the federal poverty level. 55% of our children rely on either Medicaid or CHIP for health care coverage. According to the Robert Wood Johnson Foundation's 2017 Pennsylvania Community Health Ranking Report, Fayette County ranked 67th out of 67 counties in Pennsylvania in health behaviors, including smoking, excessive drinking, and alcohol-impaired death. Like many counties, we're in the midst of dealing with an opioid crisis. So we're dealing with not just economic problems, but health and health behavior problems, which also add to the expense of public resources. Our economy and our residents certainly need help. Many families rely on various public assistance programs. As of April 2017, 43,238 county residents were eligible for Medicaid for health insurance, about a third of our population. 31,000 residents counted on SNAP, and its average of $255 to feed their family for a month. The resources are often not enough, and so many of the families, about 3,500 households, turn to the county's volunteer food pantries for further assistance. We need to take steps to provide greater assistance to aid families to transition to household sustaining work, which would substantially reduce the cost of public welfare for both the state and federal government. And we all recognize the cost of federal and state government to help families and the pressure that government is under to reduce costs. Part of the challenge is creating incentives that allow families to transition off of these programs, helping rather than hurting the family, avoiding the cliff effect where earning $1 more results in costing a family hundreds of dollars in lost medical, food, or child care benefits a month, creating a disincentive to advance. We're here to talk to you about an investment in our communities, a demonstration project to expand the work of Circles USA in Western Pennsylvania. Circles is a national effort to help families move out of poverty. The demonstration will propose to document the results of Circles in an urban setting in partnership with East Liberty Community Development Organization, which coordinates Pittsburgh Circles and Circles Laurel Highlands, working in smaller communities in southwestern Pennsylvania. While Circles is largely a volunteer and community effort involving churches and nonprofit organizations, core funding is needed to support program staff to provide training, coaching, logistical support to volunteers throughout the region. Additionally, we would like to explore options for reducing the cliff effects, creating incentives for the family to progress. Circles Laurel Highlands is an effort to help distressed Western Pennsylvania smaller communities to mobilize local resources and enlist trained volunteers to step forward, join the work, and help struggling families in our community to escape poverty, secure employment, contribute to the growth of Pennsylvania's economy, and position the next generation of workers, our children, for success. We thank you for the opportunity to share these ideas with you.
Just want us to go? Okay, thank you. Good afternoon. My name is Chip Rowan, and I serve as the Executive Director for Connellsville Area Community Ministries. Thank you for the opportunity to speak with you today and to take a look at this problem that I see on a daily basis. I appreciate you wanting to work to correct that. Community Ministries began in 1974, and for 43 years, the ministry has provided help to those who need assistance in the Connellsville Area School District. Our service area has a population of 35,000 people. Community Ministries operates the largest food pantry in Fayette County, serving as many as 600 households per month. We also operate a crisis ministry where we assist with preventing the termination of utilities and evictions. I'm sharing this information to give you an understanding of how many people I interact with that are struggling to survive. Community Ministries' goal is to be a bridge and provide a path for our clients to move from a life of constant crisis and dependence on public assistance to a life not consumed by crisis and where they are self-supporting. Along with the Salvation Army and St. Vincent de Paul, we brought Circles to the Connellsville area in September 2014 to help provide this bridge. On a daily basis, I see families who are in crisis. Generational poverty is a battle we are trying to fight. This generational poverty is brought on by dependence, as I see it, on families on SSI, which is Supplemental Security Income, and young children that are convinced that they have a learning disability so their parents can receive another SSI check. I realize that SSI is a federal program. However, it has a huge impact on the state because the SSI recipients are eligible for state programs like Medicaid, child care, SNAP, cash assistance, and home energy assistance. My goal today is to provide you with a glimpse of what I see at the ministry on a daily basis. This is a typical conversation with a client. Imagine a 45-year-old man sitting in my office who is requesting assistance to prevent the shutoff of electric service because he has fallen behind on his payments. The intake form has him list his source of income. The form shows a monthly income of $2,235, and the source is SSI. The household receives 3 SSI checks. The client gets a check, the wife gets a check, and their 12-year-old daughter also receives a monthly SSI check. I see this constantly. I ask the client, what is your disability and that you receive SSI? And they're usually surprised when I ask them that question, but I do ask them that question. Here's a typical answer that I get. I hear this in a combination of different ways, but this is basically what they're saying. I hear that they say that they're illiterate, they're dyslexic, or that they're dumb and they can't learn. Those are the answers that I get. Sometimes all of them, sometimes just a few of them. As I talk with the client, I learned that early in his life, a parent had convinced him that he was unable to learn. So he could qualify for SSI, and that the family would get another $745 monthly SSI check. So he was pushed through school, never receiving an education because he was not allowed to learn for the fear of the family losing that extra check. He graduates and is unable to get a job because he received no education or any skills to prepare him for a career. There are 8,889 people in Fayette County receiving SSI payments. 1,455 of them are under the age of 18. I talked to a retired Connellsville Area School District employee who worked as an elementary teacher and a principal. She confirmed that the request for the school district to complete paperwork that claims a child has a learning disability so that they would be eligible for SSI was a constant happening. This has become a culture in Fayette County. Generation after generation continues on SSI. They are teaching their children and grandchildren to do the same. It's the only way that they know to earn a living. It's my observation that giving the family another $745 check is not helping the child to overcome the disability. Using these funds to provide learning support or tutoring would be the correct approach to helping the child to be a productive adult. How do you cure this? We need to break the cycle. We need to put people to work. Sounds like a constant theme here. That's a good thing. The situation that I just shared with you has no incentive for people to go to work. It creates a culture of dependence on public assistance. I believe there is a two-part remedy. The first part involves the adults. Help the adults to receive basic education training, obtain their GED, or receive vocational training to become gainfully employed. Use state programs like Medicaid, child care, SNAP, cash assistance, and home energy assistance to bridge them to being self-sufficient. Don't pull away these programs as soon as they begin to earn money. The cliff effect is discouraging people from stepping out and going to work. Offer a safety net to encourage generational SSI recipients to step out and try employment. If they can't make it on the paycheck, allow them to receive the benefits again. The current environment has no hope of change. The safety net would move some out of the SSI cycle, and moving some is a start. The exception to this is adults who have behavioral or health issues, and of course the elderly population would not be a group that we would be able to help with this. The second part involves the children. I see the most hope with this part of it. Work with educators to stop the cycle of parents using their children to receive another check to fund their household. Work to help the child to overcome the barriers. Award school districts to move students away from SSI and offer one-on-one tutoring to support these students and make them productive adults. Put them to work. So when they graduate from high school, they can go to work. I believe we will have more success with the children than with the adults, but I would encourage you to work with both groups. Circles provide support for these children through a children's program. Here's a statement and an observation from our Circles Connellsville area children's program instructor, Amanda Wingrove. Amanda states, many of the children are living in households with low socioeconomic status and are subject to acute and chronic stressors and are subjected to health and safety hazards, which lead to a host of social and emotional challenges. Parental education is often substandard in poor households, which in turn lead to decreased involvement with their children as a result of the increased demand placed upon the adults to provide for their families by working long hours and multiple jobs. Children are often left to fend for themselves. This is the end of her quote. Through a combination of circles and focused learning support in the school district, we can prepare these children for a successful life. Fayette County needs to break this generational poverty cycle, and we need your help to do that. Thank you.
Thank you. Thank you, House Committee and Representative Warner, for inviting me here to speak. My name is Matthew Kretschmann. I'm the Executive Director of the East End United Community Center. We were founded in 1975. Our focus has been children and their families, and we have an academic focus. Some of the programs that we have at the East End United Community Center is a child care center. It's the only other nonprofit child care center in Fayette County. We're 100% subsidized right now. So our families are on coordinated child care information services. We have a senior program, a caring corner program, which is a grief support program geared towards children and their families. Also a 21st century after school program that's operated in multiple school districts with some community partners. We also have a CACFP food program that we serve 150 meals a day out of the community center, and it's through an at-risk food program. So I'd like to start with a quote that was found in from the Bucks County Women's Coalition. While the American dream says that the hard work lets families achieve a good way of life, the American reality dictates otherwise. Many working families go to bed each night hungry and worried about how to stretch their income to meet tomorrow's basic needs. This came out of that report. Families have access to a panoply of programs that give them opportunity to bridge the gap between struggle and self-sufficiency. Tax credits, the state child care subsidy, and low-cost health care and SNAP benefits. While families attempt to achieve self-sufficiency through these programs, they often reach a cliff effect. We heard that from Representative Warner, and that's what I'm going to talk to you a little bit more about. That forces them to choose between a temporary but problematic decrease in income or permanent point beyond which they cannot increase their income. For example, $1 per wage increase causes a family to lose a benefit that has more monetary value than their increased wage can make up for. At this point, the worker faces a dilemma. If they accept the raise they work so hard for, their family will lose access to these programs to help them make ends meet. And in some cases, such as families lose access to child care subsidies, they may even lose their ability to work, as I said before. The cliff effect makes it hard for families to earn above the above the limits set by the state, and their families ineligible for subsidies for food, housing, child care, and other benefits. For low-income families, this means earning more money actually can put them in a worse place financially. I had a mother express to me, and this is actually, she expressed to me that a raise in your job is supposed to be exciting, but it isn't. The policy recommendations that I would like to say is to smooth out the benefits phase, so a gradual phase out of benefits as opposed to the cliff effect. In particular, since I have a child care facility, I would like to talk a little bit more about the child care subsidies. In Pennsylvania, families became eligible for child care subsidies when their income is between 200% and 235% of the federal poverty guidelines. While families must make a weekly copay, which raises as income raises, to participate in the child care subsidy, they no longer qualify for these programs when they reach 235% of the federal poverty guideline. Most families pay between $5 to $25 per week. At this point, the increase in wage may not compensate for the loss of the child care subsidy, in which case the family falls below wage adequacy until they can increase their wage by several more dollars per hour. One of the solutions that we'd like to offer is a program that would increase eligibility and phase out more gradually, so that families would be able to be ready to pay child care or on their own, would be more preferable to one that subsidies disappear. In addition, setting a 6-month grace period for payments of an increased copay would allow those increased wage time to adjust to a new copay. Thank you.
Hello, and I really want to thank Representative Warner. From the time he ran for election some time ago, he has been very interested in solving this poverty issue and has listened to us on multiple occasions, come to his office and help with the education. So my name is Becky Ambrosini, and this is my husband, Al Ambrosini, or you get one, you get the other. We've been volunteering many, many hours towards this solution to help impact the poverty in Fayette County. We've heard that 19.2% is the poverty level. We first began as when Al decided to do public service. He is an engineer by background. I'm a nurse and worked in healthcare for 40 years, so I've seen my share of poverty also. And he wanted to serve this county as county commissioner. He found that there was a tremendous amount of people in this county suffering. So his whole impetus for running was to help lift people up. He's now retired from public life. I can't say I'm not unhappy about that. And we together are going on, continuing this journey. So about 4 or 5 years now, we've been working as volunteers to help with poverty. We began, as you heard, from Chip with the Connellsville Circles group. That was our first volunteer work in trying to help poverty. We've learned a great deal. I had no idea what poverty was before we started. And since then, we have had this vision that we wanted to move circles from Connellsville throughout Fayette County. So you have heard from Jim, who has become our partner in trying to spread circles out of poverty throughout Fayette County. All of the funding from circles right now is from the generosity of foundations and individuals. Circles' mission is to inspire and equip families and communities to end poverty. In other words, the only way this can be done is by finding that population in poverty that want to get out of poverty, are willing to put the time and effort in with our help to get jobs, to be able to be financially solvent. That is our goal. Circles is a volunteer-centric researched process. Our founder has been working and researching poverty for over 24 years. Our founder is Scott Miller. This is a volunteer program, and we bring existing services, government, nonprofit services to the table together with us so that there's no duplication of services, so that we don't spend any more money than's already being spent. And we take advantage of that collaboration to be able to help these families and creating partnerships with of all these individuals, including government. Our Circle's goal is to concentrate on the social capital required for each family to meet their goals and objectives to get out of poverty. When I say social capital, what I'm talking about is building these relationships that we all have had in our lives. Relationships with grandmothers and grandfathers and individuals that have helped us, mentor us, and knew the way. Some of them were poor themselves, but they knew how to work and to budget and to get through life that we didn't even know we were poor half the time. Like I said, I didn't know what poor was until I joined Circles. So we do this through inspiring families and individuals in those families that want to help get out. We provide ongoing peer-to-peer weekly support meetings for adults, and we create individual circles for those families with the support of middle and upper class volunteers. This is a volunteer-centric approach. Families and volunteers gather for a weekly meal, and this helps build relationships. There's not any trust between people in poverty and middle class. There's no trust. They see us quite differently. We live by different rules than they live by. The culture of poverty is quite different than the culture that we're used to. And so we have to build this trust in order to even help them move on to a independent state. The adults in these groups then separate after the meal. The adults, the volunteers, and the allies or the mentors of these families. These are the middle and upper class people that volunteer to do this. What these mentors do is they give them a relief valve. We know we have contacts. We know people that we can help them get jobs when they're ready. We know how to help them get a job. We know how to help them keep that job also. These adults every week have this class that's through education, goal setting. Goal setting is something that is very foreign. We spend a lot of time teaching people how to set goals, whether it's an hour goal, a day goal, or a year goal. We also have the children go off, as Chip said, into another room, and we have a specific curriculum for these children. It was actually developed through the National Circles USA, led by a Connellsville native, Wanda Reynolds, and we have that to thank. There was no curriculum before she came along. This curriculum teaches children how to get out of poverty, and we teach them how to help their parents get out of poverty. They put more pressure on their parents than any government facility, than any law enforcement or anyone at this table. Those children are helping us. We also concentrate on academics if they need it. And we also concentrate on discipline. How do they set their own goals for themselves in their days? And we call it discipline. It's really goal setting on their part. We also have fun in the guise of all this. So the children think they're having fun and learning at the same time. Around this circle structure, we have some paid employees, but it's very minimal. We also have this structure of 5 different volunteer collaborating teams, and they address poverty in the community as well as support these families. The first team is called the community team. They work on the weekly meetings, make sure it's an effective, efficient curriculum. We have all the food we need, and they coordinate the facilitators and the children's program. I volunteered Matt for that, in case you want to know. The recruitment team finds the families that have specific criteria. We cannot help families that are in crisis. We cannot help families that have drug and alcohol problems, and we cannot help people who are homeless. These are individuals that are ready to get out. They come to us pretty angry. They don't know why they're in this situation because of the generational poverty, and they're angry at the world. But when they come to us, we put a positive light in their lives, and it's remarkable. I mean, 2 or 3 meetings, and they start changing their thought process that they're stuck, they're hopeless, and there's nothing else to do. So we recruit these volunteers. We also have a jobs and education team. And that jobs and education team is responsible to go out into the community, form relationships with employers, form relationships with educators, with PIC, with other organizations that already exist, and say, we're going to find you individuals that have social capital now that can get and keep jobs, and we will refer them to you. There are other, these are very successful relationships, and they are just dying to get employees. So us supporting that social capital, they're coming to the plate to help hire these people because they know we can vouch for them. And they know where we live too, so. We also have a service team that brings together all of the community services that we don't provide and says, if we have someone that comes to us that needs this, we know where to direct them. We don't replicate it, we direct them in the right place. And then we work with those relationships we've built with those areas. And lastly, we have a Big View team. This is to solve systemic barriers. We have a big problem with cliff effect. You've heard about that. I'm not going to get into that again. We also have a problem with the social understanding, our peers, our middle class peers, understanding what poverty is because of all the negative connotations that comes with it. So yes, there are problems, there are abuse, there are individuals that should not be getting assistance. But we want to concentrate, we want you to do that, and we want to concentrate on that percent that we can help. We have the newly created Circles in Laurel Highlands Regional Chapter. It's a regional chapter. So our hope is that we can reduce poverty in this region that we define by 10%. We have joined other chapters all over the country, Circle chapters, to do this. As I said before, it's a community-driven way to solve poverty. We believe that the responsibility for both poverty and prosperity rests not only in the hands of individuals, but also in societies, institutions, and communities. Our approach is a progressive model grounded in research, and it shows families how to have this strong social capital. Our goal is to improve their economic situation and overall quality of life by getting them off of assistance. We are committed to supporting families and individuals in those families who will get them out of poverty. They must make 200% of poverty level to get off of assistance. They must bring that earned income in. So that is our goal, to get these individuals to 200% of poverty. I do have to note that at 300% you're thriving, at 200% you're surviving, but we're starting with the 200%. An example of a family of four, they need to earn $47,000 a year of four to achieve financial independence at the 200% mark, $47,000 a year of family of four. I know that this sounds daunting. It sounds daunting to our families when they come to us. And some of them even feel it's impossible. But it is imperative that we publicly acknowledge what it takes to get out of poverty. We tell them from the beginning what it's going to take. So one more statistic in Fayette County, and this is a statistic, there are 18,000 children below the 200% of poverty rate. It has been recorded in some research that costs $30,000 a year per child per year until they're 18 years of age. You can do the math on these 18,000 children. You know the math, you're dealing with it all the time. Unfortunately, you've heard from us that our current welfare system and other assistance programs have been designed by very well-meaning people, but they are keeping the poor poor, and they have created this generational poverty problem. We must solve the generational poverty. We are seeing fifth and fourth generation young people come to us now for help. They're angry, but they don't know why. And we turn them around, and they are working, and they have hope now, and they don't want to move out of Fayette County, which is a good thing, because they're working. Just a little bit of demographics of Circles. We have a database that we utilize. So what we have found is the earned income, which is the primary indicator of success and progress. 41% of all those enrolled in the Circles program nationally increased their income by 41% after 6 months. After 1 year, that increase goes to 60% increase in their income. And after 18 months, 88% increase in their income. Now, the only problem with that is they're starting very low. And that increase, while it sounds significant and better than what they had, they're starting to hit that cliff effect. So then we start to struggle from 18 months to 36 months. Between 18 months and 36 months is usually when they can hit the 200% rate. So if we have some smoothing, that would help. We also found that in 6 months, our unemployment of those individuals that come to us decreased by 40%, and 44% of them by 12 months who have full-time jobs. So what we are asking is that, first of all, we need jobs and good jobs, but these individuals often work 2 jobs to get these income, and that's okay too, because they're working hard. We want to eliminate the cliff effect disincentives, as you've heard. We are taking the challenge, and we will take on communities and help design and implement plans to reduce poverty by 10%. We want to engage communities, or businesses and communities to provide those opportunities so that we have some economic development. We want to equip these individuals and workers with skills for the 21st century. And that's my last page, you're lucky. So anyhow, we're on this journey, we're doing well, you've heard from all of us, and all 5 of us are here to answer any of your questions.
Well, first of all, thank you for your great work. And thanks for taking time away from that to share with us. It's what these policy hearings are about, to get a little bit better informed what's going on in the Commonwealth and in areas different than our own. We have several members with questions. I think we're going to start with Representative Dowling and Topper.
Thank you, Chairman. I've had the opportunity to meet with these individuals before and think that I have a relatively good grasp on the program they're doing. I congratulate you on your success that you're having in our area, in our region. I do have a question I'd address to Mr. Crutchman, but if there's someone else who would like to answer, you're more than welcome to do so. You talked about smoothing the cliff effect, and I think that's something that perhaps we could work on from a legislative standpoint, if I understood your testimony correctly. So I would ask, there was a program you were talking about where you were increasing copays and putting a 6-month period in place. If you could just expound upon that program or request a little bit so that I could understand that better.
So, thank you. That actually came out of another report that I was reading in terms of for coordinated child care information services. In that, basically, it was they wanted what our families, and we're even seeing this at the community center. What's happening is our families are getting jobs and they're getting a pay increase where they're losing their child care, so they can't take that pay increase. Basically to smooth that out would be to have a 6-month grace period where when they received that pay raise, they would actually be able to like start to gradually pay their child care for their child care. So do you understand what I'm saying? Sorry.
Yes, and I assume that would also work for other benefits that they're receiving, correct?
Yes, and it could be, it can be across all of the benefits, yes, absolutely.
Really, the only way to, our founder tells us this all the time, the only way to smooth this out is to prorate things, to prorate the benefits, which is, we understand, is an administrative nightmare for government. But really, that is the only way that you can administrate the smoothing out of these of the cliff effect. So as they earn, they go away.
Thank you for that point of clarification. Thank you, Chairman.
I forgot my own order here. Representative Topper, then Senator Succumb.
Thank you, Mr. Chairman. Mr. Rowan, you had mentioned about the intellectual disabilities being, whether real or perceived, being one of the main disabilities that you saw, reason why people felt like they couldn't work. It kind of struck me when you said some of the reasons that they gave. They felt they were too dumb, didn't have enough education. But then I'm sure there are some with actual intellectual disabilities that would limit what they could do. And then Mrs. Ambrosini talked about the connecting employers with some of the folks that you have through circles. So I wanted to talk about both of those. Do you have, for those who do have maybe intellectual disabilities, they can work, but they can only work certain jobs. Maybe they can't drive. Maybe there are limitations. Have you seen a connection with the employers you're trying to reach out to who say, look, we can still provide this segment of the community with jobs, and has that been successful?
It has been. In small situations, we would like to see that happening more, but we have one gentleman who is kind of like our poster child for circles. He actually came to us unemployed, and he has some learning disability. His education is somewhat limited, but he's a very hard worker, and he actually volunteered for us at the ministry, so I could see his work ethic and what he was doing there. And because I knew someone in the community that had a business that was willing to take my word to hire him, he's actually moved up and is now full-time, has benefits. He just bought himself a car. He rents his own apartment. So if we can make those matches, we need to do that more. I wish I could multiply that time and time again. But because we're able to actually start a relationship with these people and they begin to trust us, and Becky mentioned that, most times in the clients that we deal with, there's no trust at all because everyone's trying to take something from them. When they get their check the first of the month, everyone's around them and they take all their money and then they're broke. And that happens all the time. So eventually they start to trust us. So we can encourage them that work is a good thing.
And it would be important for the employers to trust you as well, because that's obviously a relationship that if they're going to take that risk, with their payroll, they need to feel comfortable as well.
They do, and that's one of our goals, is that we will actually be almost like an employment agency, that when we would have someone in circles that has went through the program, that we have employers that are waiting for these people to come out knowing that they're good employers, good employees. The employers need people to work. The intellectual disabilities, if you don't mind, I'd like to touch on that a little bit. There are some people that are truly disabled that aren't able to work, and that we aren't going to be able to help them. But what I was referring to, and what I'm seeing a lot of, is people that are now adults that were convinced because of some disability that could have been corrected when they were younger, that wasn't taken care of. And because that wasn't taken care of, they're now an adult who can't read, and they aren't very employable. It's hard to find them a job. So those are difficult things. We learned early on in circles that if you aren't willing to work, we can't help you. Work is the key to that. So people that come into circles, they have to understand that our goal is to get them a job, or a better job, or one that has benefits with it that would help them. So we're real clear about that.
And perhaps maybe statewide, is most of our welfare reform, if you'll call those efforts, have focused on the accountability or incentivizing work from the individual who's on assistance. Maybe one of the things, Mr. Chairman, we also need to look at is incentivizing the employers who would be willing to step up to the plate to hire folks who maybe before had been deemed unemployable. So lots of things to consider. Thank you all. Thank you, Mr. Chairman.
Mr. Saccone and Mr. Nelson.
Thank you, and thank you for what you all do. Just so I understand the numbers here, when you say 200% of poverty, what's the raw dollar figure that we're talking about there?
So a family of four is the example I gave. So a family of four would reach 200% of the poverty rate at $47,000 for that family.
To me, I'm just telling you, that sounds like an incredible amount of money. If you're telling me people get benefits up to 200% of poverty?
No, what I'm saying is that the poverty level, well, they do get benefits at different levels of poverty. So some of it gets cut off at 110%, 115%, but it gets cut off at different levels. What I'm saying, for them to totally get off of assistance and survive, that's how much they have to make, 200% of poverty. For a family of four,
Not buying it.
the poverty rate is around 24,000 for a family of four.
Okay, that's the poverty, because I'm not buying the 47,000. I mean, most of my taxpayers don't make 47,000,
Yeah.
and they're paying for their own family, and they're paying for these benefits.
Mhm.
And this is what angers them.
Mhm.
It really does. So, when they see someone that's, you use that $47,000 figure, it isn't going to fly with most of the people that are paying taxpayers, that are holding down jobs and paying the taxes for these benefits, and they feel like they're getting the short end. They tell me all the time, "Why I'm just going to go on benefits. Why should I keep struggling to pay taxes for people who are actually holding out because they got this cliff effect or whatever? They're holding out." No, the incentive should be, yeah, I might be at a cliff effect, but it's better for my dignity to get a job and not rely on the largesse of others. It's better for my own dignity to get a job, even if I'm at a cliff effect. I understand the smoothing, and we can work on that.
We encourage them to get a job regardless of cliff effect. And that's our goal, is to get people a job. I'm stating how difficult it is for some of these families to reach that. They don't get benefits over a certain number. You know what those numbers are. I'm not a benefit expert. We have a couple here at the table. But benefits drop off. And what is nationally known is that you have to make 200% of the poverty level to survive. At that point, they're off of all assistance, and they are, saving for their children's college and those type of things. So that's the level, not of assistance, but of being able to be a citizen who makes enough money to do these other things as well as take care of their family.
Okay. I mean, you're here testifying. I appreciate the charitable work you do. I'm just saying, taxpayers are really upset right now.
Oh, well, we're taxpayers too. Believe me, we do our share. And we're not happy about the system. And we were actually very encouraged, by the first speaker to try and get rid of some of this fraud and abuse, because we don't want it either.
Yes. Thank you. Thank you for what you do once again. Thanks for coming to testify.
When it comes down to passing some of this legislation, we may need your help, because at the end of the day, we can have all the hearings in the world, but if we don't get 102 votes to pass some of these things, I've been in legislature long enough, simply putting a photo ID on a EBT card is just monumental discussions, and ends up in 2-hour debates in Harrisburg, which is ridiculous. And in return, they sell them as commerce.
Well, we actually invited Scott Miller, our founder, to come today, because he is much better at this than all of us. And he has actually been engaged by the state of New Mexico legislative body to help them solve their poverty issue, which, believe it or not, is worse than ours.
Well, Ryan will be a good asset. We will have another hearing probably in central Pennsylvania, down Harrisburg area, so maybe we can have him on board. Representative Nelson and Representative James, rounded out by Representative Warner.
Thank you, Mr. Chairman, and thank you again, Representative Warner, for hosting this, very important subject. I wanted to take a moment and echo what Mr. Rowan was talking about, that he sees in Fayette County, and that exact same thing is happening in the schools of Westmoreland County, where people who are knowledgeable about that SSI program even bring a third-party advocate to that meeting to force the school to document those types of behaviors. Trying to build on and connect some of the testimony from the group today. Earlier, we touched on maybe the need for teeth in the program from the fraud side, and those people who are intentionally stealing and diverting money for a well-intended program and taking it for their own personal gain. Chip, who I've known for a number of decades and is an outstanding individual, it's easy for you and your high quality skill set to be able to have those relationships with businesses. Can you touch on what you feel may be some important elements, so that people who are receiving utility assistance and CHIP, and they're having all of these programs? Earlier in Maine, they talked about a job or volunteerism or training, and I think getting a GED would be part of that. Some of what I see is there's just that sloth factor, that it's easier to just stay seated, and there's not the stick. There's a whole lot of carrot, maybe sometimes to do nothing. So from your perspective, how can we structure into policy a little bit of, insurance that they must participate in one of these types of programs at a tiered level?
Thank you, Representative Nelson. It's hard not to call you Eric. What I see is actually the need. You mentioned sloth, and I see a lot of that. I've been at the ministry for 4 years now, so I'm from Fayette County. I actually was born and raised in Fayette County, grew up in Mill Run, lived about 2 miles from Falling Water, so this is home to me. And I thought I knew exactly what was happening when it came to poverty until I was in this position. And I have been overwhelmed with the number of people that don't work. I'm just overwhelmed by the number of people that do not have a job. And to answer your question, we need to encourage them to get a job. For folks that are able-bodied and able to work, we need to encourage them to get a job. We have volunteers that come to us at the ministry because they're required to do that. Public housing now requires that they do that, and we receive volunteers. I can tell you many of those people that are volunteering are good volunteers, and they're able-bodied. But what I have found, and this has kind of been really convicting to me because I was rather judgmental when I went into this job about, well, they're just lazy, they don't want to work. Sometimes that's true. But I have found that if I was raised the same way that they were raised, I would have turned out the same way that they turned out, because that would have been my norm. That would have been the culture I was raised in. I was blessed to have been raised in a family that works. My father worked, my grandfather worked, and I saw that. That was typical for me, was to get a job, save money, and buy things. That's how it worked. And someone else wasn't going to buy them for you. The folks that we serve, and we're a ministry, and we do the work that we do because the Bible calls us to care for our neighbor. And that's why we're doing what we're doing. We're not a service, we're a ministry. We do that for a reason because of that. But what I'm seeing is these folks aren't encouraged. They've given up on themselves most times. And earlier on when Sam was talking, his testimony was great, by the way, and there's a lot. I see what he's saying, I see every day. And so I would take his word and move on that somehow. But they have just given up, and they don't know where to go. They don't know what that next road is. And we need to provide them that path. So we, as a state, we need to find opportunities for employment. We need to make sure that there's a road for them to go. I talked about the ministry being a bridge, and we have to have a path for them to go. And that path requires us to not let them drop off that cliff. They're never going to try it. I actually had a volunteer who I eventually hired as an employee that I had to get an accountant to convince him that it was better for him to play into Social Security and retire on that than to stay on SSI. I had to go through that route because when I offered him, it was $10 an hour. It's not a great wage, but it was $10 an hour. I had to convince him that it was going to be okay for him to give up SSI. He said to me, I'm looking to retire on that. He was in his 40s. So we need to find a way, to encourage folks. There needs to be limits to it. And the difficult part is actually knowing who is disabled. If we could really know that, that's the hard thing. I do not want to throw people off of assistance that have no other route to go. That's not my goal. I want to help people to have a better life because I know that they can have a better life if they work.
Thank you very much. And in building, just from one of what we found a successful element that we're looking to implement to help employers in Westmoreland County bring on some individuals is a 6-month deferral for workers' compensation, where the individual who comes on as that partnership, they're coming through programs that help an offset in wage, but really that workers' compensation piece makes it very nervous so that they don't have somebody to come get an injury and then fall on their roles as an important element. But to underscore a little bit of the frustration from the, what I feel is an elevating cliff, currently within our pre-K counts program, that includes 100% child care up to 300% poverty level, which for that same family of 4, So that means that families in this state that are making $73,800 are receiving 100% of their child care covered. This type of program should be tiered moving forward, so that in a tier, but when you cross 250%, which would be $61,000, maybe you're paying for 25% of that child care, which would allow us to have more children in early education, and then potentially 50%. But that tiered concept, it's almost like by having a great program like this, we've elevated the height of the cliff to make it more difficult for families to be able to self-sustain. Can you touch on that, sir?
Absolutely. In what I was referring to in the whenever I speak, it's actually before pre-K. We're talking infants, young toddlers, so it's before that age. But that absolutely does work. We are. I'm very familiar with pre-K counts. We are also in the Keystone Stars, which they're kind of redeveloping what they're doing right now. So, but absolutely, that does work.
Thank you, Representative Nelly. And we'll have Representative James and Warner and then Grove.
Thank you, Mr. Chairman. I think we're at the point where you are all on overtime now, so I'll try to be a little brief. Pastor Chip, no, I'm not done yet. I understand what you're saying about the work ethic, because my folks said to me, you will find something to do, and I started working when I was 15, and with the exception of a few years of full-time student endeavors, there's never been a time when I didn't have at least one job. But that's fine. I'm good with that. I'm aware there are inconsistencies, and this chart right here, which we all have in our packets, kind of shows that even in the Commonwealth of Pennsylvania, we're terribly inconsistent with the way we apply whatever legislations that we have, and I can see that's a place to make some positive changes too. And as an example, I'm aware of a young lady who got in a family way. She worked like a dog until something like 3 or 4 weeks before she gave birth, and the father of this child stayed with her until she came home, then abused her a little bit and left. So she pulled herself up by her bootstraps, went out and got a $10 an hour job. She had coverage with medical coverage and with daycare for the young man, and then she got a job, or she got a raise to $13 an hour and lost half of that. So she went backwards, but by God, she was going to continue on, and she's doing okay. But I understand that approach. As little as I know about unemployment, I do want to circle back to circles for a minute. I'm curious about how and where you get your volunteers. I'm curious about funding. Are you so well organized and have so many volunteers that you don't need funding other than what you are all willing to put on the table? And are you affiliated with churches in any way?
Okay, that was a multi-part question.
Three-part question.
Okay, so anyhow, first of all, Circles has traditionally been funded through the generosity of foundations and grants that are private grants. United Way, others have helped us. The sustainability of Circles is what we are trying to achieve right now. So we know that it's going to take us 10 years to affect 10% of the poverty rate, to decrease it by 10%. And so we are relying on the generosity. The meals are given by churches and other organizations. The facilitators are volunteers. My husband, I was teasing Jim because I think I had 40 hours of volunteer work last week, and he wanted to sign me up for a senior program. But we do have, these volunteers come from a lot of faith-based organizations. They also come from organizations that organizations that encourage their employees to volunteer for things. There are organizations that will give us money here and there to help us out. There's individuals that give us money. That's how we're running our current process. Now we want to take it so far past where we are now that we need help. If you gave us money to help us with the cliff effect, we'll worry about the rest of it. Is basically what we're saying. And but there have been other states that have invested in circles. Right now, they're being employed to national, not us. To there was a state, was it Kansas? I think it was Kansas, that just hired 90 people to help people who not only to get the job but to keep the job. So they are caseworkers that all they do is help that person keep that job. Can you believe that? So, and they're having trouble. So they want circles to be part of this to teach these people how to get social capital to keep their jobs. That's the funding part. What was the other part? I'm sorry. Churches,
Yeah,
yes.
church affiliations.
Yeah. Actually, a lot of circle sites are churches because they have the facility and they donate the time or the facility to us. So we don't pay for our facilities. We would never go somewhere we had to rent a place. We also, those churches then also usually give us some volunteers. People volunteer. It's a part of their ministry. We have the partnership actually in Connellsville is with St. Vincent de Paul, Salvation Army, and Community Ministries. And we get volunteers from those areas. We also find people who want to do public service. And we encourage, this Circles program is about giving back also. So as they go up this journey of independence, our expectation is they give back to Circles and they become allies and they become volunteers and they become mentors in that program or in the community, whichever is appropriate. So we haven't had problem finding volunteers. We've had a learning curve in finding the individuals that want to get out of poverty. Volunteers are easy compared to that. And so we've set up specific criteria that they must meet and go through interviews to be able to qualify to get into the program, and that's helping us, find the right people. We've also engaged with children and youth services and other areas in the county that actually know these people a lot more than we do, a lot better than we do, and they know individuals that are trying to get out, and they're going to be doing the referrals of those leaders to us.
In my area, final comment, Mr. Chairman. There's a group called Mustard Seed Mission. If you're familiar, you know about them?
I've heard it.
That's great. Kind of self-formed, but they seem to do pretty much what you're doing and do a fabulous job of it. Thank you very much for your testimony.
You're welcome.
I can jump in just real quick. Some states have used TANF. I think the challenge that we have is how do we bring it to scale so that we can get more people off of public assistance into good jobs and moving forward as a family. I think that's the challenge we're facing now. We had discussions with foundations. Community Action was able to bring some money to the project, so we're piecing together a lot of the funding. But it's really that core funding that is a challenge to raise. Thank you.
Representative Warner, and then we will be closed out by Representative Grove. Again, Ryan, I wanted to thank you for helping put this together. This is very, very, very helpful and very informative.
Thank you, Chairman Benninghoff. First of all, let me thank each and every one of you for coming out to testify today. I really appreciate it. I had quite a few questions, but for sake of time, I'm going to boil it down to one. I can get a hold of you guys anytime. You know that I'm a huge advocate of ending the cliff effect, right? Firm believer that it would tremendously help our welfare system. As Chairman Benninghoff mentioned earlier, though, legislation is not easily passed. It is quite a process to have a bill signed into law by the governor. And there's a lot of different welfare programs that exist. Okay, so if we, as representatives up here, we're going to tackle one program that you saw the biggest issue with that was affecting poverty, that the cliff effect was affecting, okay, which program would you have us look at and try to change?
Medicaid probably is, people losing their health insurance is a problem because the money, that's what I see from my vantage point. The money that it takes to replace that, it's going to be a while before they're able to make that. If they're new into the workforce or haven't had a good paying job and working through that process, I see Medicaid as a big issue, somehow allowing them to work longer without losing that benefit sooner.
Especially when there's children involved. I'm paying my own health care now, and so I can't imagine anyone else being able to do that and have these problems.
Thank you very much. And we are going to close out the questioning with Representative Grove.
Thank you very much. And kind of follow up on Representative Warner's comments. As individuals kind of move up in salary and start, hopefully the goal is phasing them off welfare, there's some realities that strike them. SNAP benefits, you don't collect sales tax on it, so your dollars can purchase more as you go to the cash register. Take-home pay, higher income, more taxes you pay. I guess a great reason there's the percent rate rather than a flat rate on income. Healthcare with Medicaid, premiums and co-pays virtually non-existent within a Medicaid package. So there's some real realities as they move up. I'm a believer in treating equal people equally. So if we're preparing people to move out of public assistance, we should probably prepare them for the realities of what that is. So premiums, co-pays, health savings accounts, allow them to build up an account for when they leave, they can have those dollars readily available for emergency needs to help pay higher co-pays and stuff. Is that a process you think would be beneficial in your discussions with your clients for the realities of what they pay, what they will face as they move out, to try to build that in the system? And it may not be a lot, but some remnants of it, just so they can prepare themselves.
Well, we do prepare them. It is a gradual introduction because you can tell from what I said that daunting, almost impossible to get out. So we work with them with goals and objectives. And so with each of those escalating, then the challenges become also. But we tell them right up front how difficult it is, because we're there to help people get out of poverty. And if they don't want to, they have to decide early on. We have a 12-week weekly class that everyone must attend and complete before they're accepted into the Circles program. And part of that education has to do with some of these barriers to getting out of poverty and to setting goals and objectives to see where they want their lives to go. We have about a 30% dropout rate at that point. As soon as they understand the challenges and how difficult it is. So, and we do that on purpose because we don't want to spend our time on someone who is not willing to continue to work at getting out of this.
Do you think it would be effective for us to build in co-pays, premiums into our benefits packages to assist them with the realities of what they're going to see in the private market?
Oh, I see.
Yeah.
Well, I guess we would have to, if we did it on a prorated.
Yeah.
Absolutely.
I don't mean, like
Absolutely.
$100 for
Yeah.
every single copay visit.
No.
I'm talking about
No.
the reality, like you skin in the game almost, and say this is what you're going to face when
Absolutely.
when Medicaid is over and you go to that private market.
Mhm.
There's a fiscal reality of copays. You're going to pay X amount to go to
That's
the
right.
doctor.
That's right.
Something to start getting them almost trained to that reality of what they're going to see within that private market.
And I think that would encourage people to get jobs too. So I mean, that prorating is just so imperative. We're just dealing with this generational poverty that is just, well-intentioned people got us here, but we are here, so we have to deal with it. And just cutting off benefits, as none of you want to do that. So some prorated to encourage these individuals and a program like ours that gives them that social capital to get out there and get the job. They're scared. They don't know what the expectations are of a job.
And what's your like cost per client? Just curious.
So if you look at over a 10-year period, we're expecting that our cost per client per year is around between $1,350 and $1,500 per family per year.
Thank you.
If you give me that, I'll solve the problems of the world.
Deal.
Thank you very much, Representative Grove. And as we close out the hearing here, first I'd just like to thank Penn State Fayette for the use of the facilities. They are always great. Joe, thank you very much. The staff members that were here have been Bob Nye with Chairman Benninghoff's office has been fantastic to work with. My staff, Melissa Tazan, was here. She's helping Bob out. Thank them. I'd also like to thank Commissioner Zimmerlink and Commissioner Lohr for stopping in to the hearing earlier. The members, of course, some of you guys have traveled very far. I think Aaron, Representative Coffer, may have been the furthest. But the York County delegation here, that's quite a haul too, so I appreciate all you guys coming out. Sam, you have the furthest travel though, all right? You're all the way from Maine. Cannot tell you how much that we appreciate you coming to Pennsylvania to give us this information, which was fantastic. Really, really appreciate it. And to the testifiers here at the table, over the last 2 years, I've got to know each and every one of you and worked with you personally, and it has been fantastic. Especially the ministries I've worked a lot with during our flood in Connellsville. You guys were amazing, and each one of you guys provide benefits to Fayette County. I think the Circles group is great, and I love the slogan, a hand up, not a handout. And just to touch on one final thing that we mentioned, Chip, you said the recurring theme was jobs, and that's, of all the things that we discussed, that's absolutely correct, right? And we mentioned a Ronald Reagan quote earlier, but I think one of the best ones of his that would apply to our hearing today is that the best social program is a job, and that's what we should strive for everybody. Again, I'd like to thank everybody for coming out. I think this was great. We got a lot of good information, and we'll be in Harrisburg next week, and we'll get to work. Thank you.
Okay.